No warning, no changes to your insurance, yet you stand at the pharmacy counter looking at your monthly medicine. Usually, it costs you $15. Today, the screen displays a shocking total of $240. Your money vanishes quietly, targeted by an invisible network deep inside the healthcare system. This is not a temporary glitch, and it is not a typing error. You have just walked into a calculated digital trap engineered to track your lifestyle habits and manipulate the price of your survival. Here is how they do it. For decades, Americans believed their private medical records were protected by absolute legal secrecy. You trusted that what happened inside your doctor's office stayed there. But behind the scenes, a multi-billion-dollar shadow industry has quietly bypassed these protections. Massive corporate entities known as medical data brokers now monitor your daily life without your knowledge. They actively buy your commercial data from credit card companies, grocery store loyalty programs, and web browsing history. Every single transaction you make is collected and converted into a permanent digital profile. Privacy experts fear that these profiles are being built entirely without consumer consent. The force driving your sudden pharmacy price spikes is a complex network of predictive algorithms. Private technology corporations use this massive stream of personal data to build a secret health data broker record system for every citizen. This profile evaluates your biological liability instead of your debt history. The software processes your behavioral patterns to find a precise psychological threshold, calculating exactly how desperate you are to receive your medication. This hidden operation is known as surveillance pricing. Investigators say that if the algorithm detects vulnerabilities, it signals the network to inflate your costs in milliseconds. Many Americans are beginning to question how their private habits are being turned against them. The financial drain becomes completely inescapable due to a highly consolidated corporate structure. A small handful of powerful middlemen known as pharmacy benefit managers control the digital networks connecting your doctor, insurance, and pharmacy to practice dynamic prescription pricing. When the pharmacist scans your prescription bottle, the computer reviews your secret risk profile in real time. The system can instantly inflate the cost of a generic drug for one specific individual while keeping it low for another. Consumer advocates warn that these middlemen operate with zero visibility, creating a perfect environment for corporate manipulation to thrive. If you attempt to question the shift, you hit a wall of automated customer service lines designed to exhaust your patience. Your personal well-being is no longer a private biological matter. It has been converted into a continuous revenue stream for private digital networks. The tracking algorithms document your entire compliance history, predicting whether you will skip a dose to save money. Consumer groups are increasingly questioning how these systems operate behind the scenes with so little oversight. When public health infrastructure is managed by predatory algorithms, basic survival becomes a luxury service. Working-class consumers are systematically forced to choose between groceries or life-saving medication, while automated pricing models maximize corporate profit margins. Many Americans are only now realizing how little transparency exists inside these massive networks. Every single day, millions of Americans walk into a pharmacy, trusting the system exists to protect their lives. They believe the prices they pay are based on fair market value and objective medical necessity. But when the very system you rely on for survival is constantly tracking your purchases, analyzing your desperation, and changing your prices based on your secret profile, who actually controls your health? Are you a patient receiving necessary medical care, or a captive source of profit inside an invisible machine? Let me know what you think in the comments below.